Hi, my name is Lou Groce. I'm the PIO for Kern BHRS. I'm here this morning with Dr. Olango and Allissa Lopez. And this week is National Eating Disorder Awareness Week. Please go ahead and introduce yourselves, your title, and how long have you guys been with the department?
Dr. Olango, Medical Director, Kern Behavioral Health and Recovery Services, and I've been with the department for about 5-6 years.
Allissa Lopez, Medical Services Administrator, and I've actually been with the department almost 8 years.
Allissa, why is it so important to raise awareness for eating disorders and specifically during this week?
Well, it's really important to raise awareness of eating disorders, and this week we've got the county on board to light up the building, just make it that much more impactful because eating disorders are often hidden. Dr. Lango and I were discussing this morning that eating disorders are more commonly recognized by loved ones, whether that be parents, grandparents, extended family, friends. The individual who suffers from an eating disorder, more often than not, can't see the impact it's having on their body. So we want to bring awareness to our community, to the clinicians that are serving the individuals struggling with these diagnoses, and just letting people who are suffering know that there's help out there for you.
And Dr. Lengo, if you are a parent or a loved one or even a friend of somebody that you think might be suffering or having one of these disorders, what are some of the signs that we should look out for to get these people the help they need?
Yeah, well, great question, and I completely agree with what Allissa said. It is an illness of isolation, and so a lot of the early signs may actually go unnoticed because it's not something that someone's trying to display. But some of the things that you will be able to pick up is the isolation. Is the person not eating with the rest of the family? Have they got an increased interest in exercise at odd hours? Are there physical changes? Sometimes you can see scarring on the back of the hand if it's a situation where someone's making themselves throw up. You'll start seeing additional hair on the face. If it's females, that can be also a sign as well. They may report be feeling dizzy, having sort of when they stand up, they call that orthostatic hypotension. They stand up, they feel a bit dizzy. Has their energy started to go down? Are they wearing more baggy clothes in order to compensate for the weight loss? Typically, and here's the paradox, many individuals with eating disorders, especially anorexia, actually tend to be very diligent students, and they tend to be great athletes as well. And so I think we should not be blinded by their accomplishments, and we should really connect with them and have these ongoing conversations and be supportive.
And Alyssa, these disorders seem to be more prevalent in females rather than males, but these disorders do affect everyone of all genders, races, ages, ethnicities. Can you talk a little bit more about that?
Yes, this diagnosis, like many others, doesn't discriminate. Age, race, gender, ethnicity, sexual identity, it doesn't matter. What I think we need to be looking out for and talking about is that it's okay to share that information with the people you care about. And if you don't feel comfortable sharing that information with your loved ones, finding somebody who you can talk to. Our young people are facing a whole lot more influence from social media and the external world, that it's important to understand what they're seeing.
And Dr. Olango, as a parent myself of two little girls, what are some things parents and loved ones can do to kind of shape conversation around eating and food to potentially avoid some of these disorders down the road?
Well, I think one of the modes of treatment is has to do with family therapy and the connectedness of the family and the lack of isolation that would kind of propel someone along those lines. So having that connectedness, having meal times together, I think that's important. Defining identity apart from how someone looks or how much they weigh, defining their identity based on more intrinsic characteristics. I think having their self-worth separated from just a physical appearance, I think it is important. And then I think just healthy eating. Eating for energy and nutrition and not focusing on calories, I think is important. And I think if there's that communication, it will be picked up with time.
That's great insight. Appreciate that. And Allissa, just to wrap it up here, what are some of the resources available to people? How can, if you're concerned about somebody, who should you contact? How would you get in touch with the right people?
Yeah, so you can actually reach out to our access line or 988 to get help, to ask the questions, even if you're unsure if that's what you're facing. I think it's important to ask the questions.
And thank you so much to you both for joining us today. And like I said before, it's National Eating Disorder Awareness Week, so hopefully you can look up some statistics and educate yourself this week on such an important week for our mental health.
So I was just thinking about the aspect of anxiety, and in my experience in working with individuals, actually mostly youth and young females, was that the eating disorder became the ability to control things within their lives when so much was out of their control. So the idea that there's mental health diagnoses co-occurring at the same time with these diagnoses, like anxiety, depression, those are the two that come to mind for me more specifically, is that a lot of the youth that we specifically work with in our interdisciplinary meetings struggle with those particular diagnoses and struggle separating their identity from the eating disorder, because it does wrap around them in the sense of control that they can't get elsewhere, whether it be the family system, their social system. All those factors play into it. So it's super important that in treatment and everything, that the entire system is wrapped around the individual. Even post-treatment, it's a lifelong recovery process. It's challenging for a lot of people.
Yeah, challenging for families especially, because they have something that they refer to as the Kubler-Ross stages of grief, which are the 5 stages of grief. And the first stage is denial, and many families just are not equipped to the possibility that their child is ill. But statistically, about 50% of cases are genetically related. It's very inheritable, and so it's a hard weight to bear, to know that your child is ill. And sometimes it's easier to explain, oh, they're not feeling that well, or this and that. But I think really having those conversations, difficult conversations, I think is important, but definitely regular screenings with a pediatrician to address just the normal health and development. One thing that's particularly crucial is that if someone has disordered eating around the age of puberty, let's say anything between 11 to 15, it might drastically affect their growth. They'll be losing weight while they should be gaining weight. It may affect them physically and otherwise for the rest of their lives. So addressing it, making sure they have the right medical attention and seek the right help, especially something that we want to screen for in all youth is any potential of suicidal thoughts, because someone that isolated may have those feelings.
It is the most lethal of all mental health diagnoses.
Yes, it is.
Second to death by suicide. And the reality is, like Dr. Olango shared, that a lot of people struggle with those thoughts too. So another, primarily we've discussed anorexia nervosa because that's what we're seeing, and that's honestly the most obvious with weight loss and restrictive eating and the feelings around food. But on the inverse, on the other side of the coin, is binge eating disorder. Eating until uncomfortably full.
The idea of what they refer to as bulimia nervosa. So bulimia nervosa is when someone is eating extraordinary amounts of food, significantly more than the calorific intake, but they find a way to purge. And so they maintain an ideal weight typically, even though they're constantly dealing with the illness. There are some medical challenges with that. It can affect the esophagus. There can be tears in the esophagus from the purging behavior, and they can be what is referred to as electrolyte imbalances, because in someone's blood, we have electrolytes. We always hear about replenishing them using these sports drinks, athletes. Well, if someone purges too much, they may end up with electrolyte imbalances, and that can be dangerous to the heart. And then on the other, in addition to bulimia nervosa, then you have binge eating without the purging. And again, that can cause what they call metabolic syndrome, when you have excessive weight gain, and someone can become pre-diabetic. They can have elevated blood pressures, high triglycerides, or all of the things that come along with that. And so the whole thought is that we can have a whole spectrum of disordered eating, as was mentioned, and each one is handled and supported uniquely. And we always want to cater the care to the individual because their story is unique.
And even more so important, why it has to be an interdisciplinary approach, right? You're hearing the medical side, and there's a therapeutic side, and the nutritionist, primary care. The entire wraparound component is integral to recovery and healthy living.
Absolutely, because in one sense, we are a community, and we need to support each other. I've heard it said it takes a village. It does.